Next case, shortness of breath. Hopefully everyone can see the gross abnormality. If anyone knows the sign, the golden sign, write that down in there, that'd be great. Exactly, well done. So this is a chest x-ray, and hopefully everyone can see straight away, and not necessarily malignancy all the time, but you need to rule that out, but yeah, well done. So there is this radiopaque region that is sitting over this area over here. And actually you can see that there's a very well-defined inferior border giving that letter S, right? So that's one of the big signs, golden S sign. So you can kind of think, yeah, slam dunk, I'm done. What else do I need to really know? But you can actually say there's a little bit of deviation of the trachea towards the right, but more importantly, the hilar looks raised when you compare hilar to hilar. And there's also tenting of the hemidiaphragm as well. One more sign that'd be worth looking for is where there's crowding of the ribs, where the rib distances look equal on both sides. And actually on this particular occasion, the ribs don't look crowded, but you definitely do have raising of the hemidiaphragm, raising of the hilum, and this radio-dense area that is located within the right apex. That would be consistent with right upper lobe collapse, which is known as golden S sign. Very, very typical. People love saying that sign. What can it be associated with? Yes, exactly. It can be associated with malignancy, hilar lymphadenopathy. So quite important to have a look at the hilar and make sure there's no evidence of any increased density. In this particular occasion, we don't have much in the way of increased density. Actually, what was going on, there was a big lymph node sitting up there causing obstruction and the resultant collapse of the right upper lobe. Hang on, I've just lost my time, man. Let me bring that back. Are we doing okay for time? Yeah, okay, we've got a bit more time.
Yeah, we have about 15 minutes left.
Okay, you know what? I think we're going to make this last one my last one, and then we can open the floor for questions and maybe some recommendations.